The situation we're seeing on the ground in Richmond is things are getting worse. We're seeing more encampments, we're seeing more messes, more disorderly behavior, more theft, and we're seeing more people suffering on the streets. You can see people who are standing in the zombie stance. They're not well, they're not okay, they're out in the cold, they're not safe. It's not okay what we're doing and how we're leaving people out in the cold.
Concerned Canadians are demanding the federal government abolish failed harm reduction and safer supply initiatives, denouncing the normalization of addiction perpetuated by these theories and the crime that inevitably surrounds unsafe injection sites. As news swirls that the Liberals' failed $1 billion safer illicit drug supply strategy has yielded no tangible results and overdoses rage on, concerned citizens are now calling on the federal government to abolish this strategy. Health Petition 4930 calls on the federal government to reform or abolish the safer supply strategy and safe injection sites, and instead focus federal funding on strategies that break the cycle of addiction and supports community safety. It points out that these strategies foster illegal drug resale, increase crime, and encourage youth addiction. Here's one instance where advocacy group Moms Stop the Harms regional director in Cobourg, Ontario, says it's okay for minors to visit their illegal nomadic overdose prevention site that pops up around the area on Friday nights.
Anything that you need, we can try to find. We can help you to sort things out.
If I have friends, can they come by too?
Tweak easy. This is the tweak easy.
They're like younger though, like is that okay?
We've got muffins.
Like they're minors, that's okay?
Oh, that hurts. Huh? We're just having a picnic.
Despite this massive amount of taxpayer funds being allocated to the implementation of harm reduction strategies, the Public Health Agency of Canada has recorded unprecedented overdoses, which are predominantly linked to opioid use. Figures have more than tripled since the early 2000s, according to data that shows numbers from 2016 and the subsequent increases between then and 2023. This has become especially exacerbated after the Canadian Drugs and Substance Supply Strategy, CDSS, was first announced in 2016. The petition stresses the fact that healthcare professionals and drug addiction experts have been censored in favor of those who unequivocally adhered to the theory of freely supplied, safe drugs being somehow beneficial to struggling addicts. British Columbia-based clinical psychologist and addiction expert Julian Summers is among those censored for connecting data that showed the inherent harm associated with the oxymoronic term harm reduction.
It has not really carried forward the idea of a continuous process or a kind of an escalator. It's instead become something that that determines success by retaining people and by other things like reducing rates of infection or rates of mortality, especially on site. But it has really lost sight of that opportunity to play a role advancing people into increasingly better positions of health and overall well-being. And that's really I think the main failing of harm reduction following its inception has been to lose sight of that opportunity for continuous progress.
Of particular concern are safe injection sites, which have faced scrutiny and even lawsuits for failing to curtail opioid use and instead putting public safety and the community that surrounds them at risk. Many of them have been established near schools, public parks, and the vicinity of these sites has fueled illegal drug resale, contributing to rising crime rates and normalizing addiction to youth under the guise of reducing the stigma. As a result, concerned citizens are demanding to reform or abolish the safer supply strategy, urging the government to break the cycle of addictions through the expansion of other programs like Ontario's opioid agonist therapy services pilot project and its injectable opioid agonist therapy that focuses on reducing addiction through ongoing medical monitoring and care.
The problem is coming more to the forefront in Richmond, and we're seeing more and more of it, especially as the decriminalization came. We've been seeing more people who are brazenly using out in public, who seem to be entitled to the spaces, to public bathrooms, to places where ordinarily everyone should be able to go. So we're seeing more problems with it. We're seeing more overdoses, more responses from our firefighters and RCMP, and we're seeing frustration in the inability to address people who have drugs and take their drugs away from them. Instead, they're given a pamphlet to say, well, here's how best to do it, and best of luck to you. Hope we don't have to call an ambulance for you later.
As the nation grapples with the devastating toll of addiction, there are grassroots movements in cities and towns all across Canada that are seeking to hold the government to account for the destruction of the failed federal drug strategy and restore community safety for all. For Rebel News, I'm Tamara Ugolini. As towns and cities across Canada descend into chaos under the guise of harm reduction and purported safer supply, we have been reporting on the destruction caused at fixourcities.com. If you appreciate this work, please consider chipping in there to support it and stay up to date by signing up for our mailing list at fixourcities.com.